Welcome to Season 1, Episode 19 of the Home Healthcare Today show. I am your host, Dr. Cleamon. It's December, and in December, we have the opportunity to focus on National Influenza Vaccination Week. Joined on our show today is Dr. Kenetra Young. Dr. Kenetra Young is a longtime epidemiologist. She is currently a Community Health Navigator Manager with the Certified Community Behavioral Clinic. CCBHC is specifically designed to provide the community with mental and behavioral health services, and they have offices all over the United States. Prior to joining CCBHC, Dr. Young was a communicable disease manager with the Detroit Health Department. She also had a role with Henry Ford Health System as an infection prevention specialist. Dr. Young is an educator at multiple universities all around the country. Dr. Young, welcome to our show today.
Thanks for having me.
Dr. Young, do you mind elaborating a little bit on your background and your passion for helping Detroiters, and with specific emphasis on epidemiology?
Yeah, so I am a native Detroiter. I was born and raised on the east side of Detroit, and I'm a first generation college student from both sides of my family.
Yes.
So I always like the bugs you can't see.
Mm-hmm.
So,
yes.
Creepy crawly things, those was fine. But so I always had a passion for helping to prevent diseases versus treating them. When I went to college at Michigan State, I was pre-med. I was laboratory science, but
Yes.
my passion turned to why people get sick. I don't want to treat them when they get sick.
Right.
Do things prevent them from get sick. So after I did my degree studies and then more research and about things, and it guided me into epidemiology.
Wonderful, wonderful. What were some of the challenges, Kenetra, along your path in pursuing epidemiology, and then how did you overcome them?
Okay, so I didn't know about epidemiology prior to.
Mm-hmm.
Then, first generation, I didn't know anyone who went to college, and you only hear about sometimes lawyers, doctors,
Yes.
you hear about teachers,
Yep.
but I didn't know what epidemiologists were. I didn't know about researchers. I didn't know about those different things. So I learned that in college.
Okay.
But it was after college that I pursued that track.
Okay.
And that just came with just trying to understand, trying to figure out what worked best for work-life balance, and my ultimate goal of what I wanted to do. And so the challenges was just finding out and seeking the information
Okay.
mostly, and just, and I had support from friends and family, and they would just support me. They never
Yes.
said I couldn't do it.
Right.
I didn't have any mentors, so I just hustled and bustled and made it happen.
Very nice, very nice. Dr. Young, for some of the younger listeners, some of the students out there that may not quite know what epidemiology is, as we segue into the conversation about vaccinations in the city of Detroit, in layman's terms, could you explain to some of the viewers out there what is epidemiology and what does an epidemiologist do?
Okay. Well, unfortunately with the pandemic, I said, people know what I do now because
Right.
that highlighted it a lot.
Yes.
And so we study diseases and the trends of different concepts or with public health about what's going on. So it's different types of epidemiologists.
Yes.
So I'm an infectious disease. You have people that's cancer epidemiologists. You have some that do like numerical data research. I like doing surveillance and
Yes.
looking at different things. So it's different forms of epidemiologists. And it's different schools, like even in Michigan,
Okay.
that does it. And then there's schools online that help, to do it. So I'm able to talk more about it, if
Okay.
someone do have questions about it. But it's a cool field.
Awesome, awesome. Thank you, Dr. Young. As we think about this being flu season, prior to our commercial here, as we think about flu season, and now a booster shot for adults as related to COVID-19 vaccines. What advice, as an epidemiologist, what advice would you give to Detroiters that may be somewhat reluctant about getting vaccinated, COVID vaccinations, booster and or flu vaccination. Any advice for Detroiters?
Mm, Don't be scared.
Mhm.
The flu vaccine has been around a lot longer. Of course, we've been fighting flu. Flu has claimed many lives as well. Fortunately and unfortunately, with the COVID pandemic, we didn't see as many flu cases
Right.
because people's, inside.
Yes.
People start doing things to prevent COVID, which is the same things to do to help prevent the flu. Wash your
Yes.
hands.
Right.
Don't be around people if you're sick.
Exactly.
Those different aspects. So with the flu vaccine right now across the country, the rate is low.
Yes.
When COVID first hit, it was during the flu season,
Yes.
and so it was. And when I was in the field working for the health department and training many people to deal with this, it was like, okay, it's new,
Right.
so it's different things, but it's transmitted the same way the flu is. It's a respiratory virus,
Yes.
and so people should get the shot. I do not believe the myth. Some people say, oh, if I get the flu shot, I'll get the flu. No.
Right.
And then so people taking that with, I get the COVID shot, it's going to give me COVID.
No.
That's not true.
Okay.
So people should do it with the boosters. The immunity, since this is a new strand of a coronavirus, which is not a new disease, but this COVID-19 is because it's a different strand.
Yes.
People, we don't know the immunity and how long to keep it, like other things. And so, and as you saw in the news, it's a new variant now that's out.
Yes.
So the boosters are so that we can keep up our body's antibody response when we are exposed to it again. And the thing is that people who are fully vaccinated, getting boosters is good. The vaccine do not prevent you from being reinfected, but if you are reinfected with a new strand, it makes it where your symptoms are not as severe.
Okay. Absolutely. So it
Mm-hmm.
it lightens the blow and the negative impact.
Yes, because the impact is negative when someone does get it. And I see in the news now everybody makes it out, and people shortchange the idea of like, oh, I won't get it, and
Right.
things like that. So people should just be safe,
Absolutely.
and get it and protect themselves and others.
Okay. Dr. Young, we're going to head to a commercial. After our commercial, we'll talk more about vaccines as well as the current organization that you are engaged with in the city of Detroit.
Okay.
Okay. I am Dr. Cleamon, President and CEO of American Advantage Home Care. American Advantage is a Medicare certified provider of skilled home health care service. It's fall season in Metro Detroit. The leaves are falling and so is the temperature. But what is rising? Our commitment and passion for homebound patients. Don't just take my word for it.
Speak up while you're in the hospital. American Advantage Home Care is where you need to be at.
Gus knows home care. Trust Gus and call us today. Welcome back to Season 1, Episode 19 of the Home Health Care Today show. Our topic for this episode is National Influenza Vaccination Week, and we're joined by Dr. Kenetra Young. Dr. Young, tell us a little bit about your organization that you're currently affiliated with, its mission, and its focus on Detroiters.
Okay. My organization is Development Centers.
Yes.
And so Development Centers been around for over 30 years. There's different locations throughout Detroit.
Mm-hmm.
The location I'm at is on Burt Road at the McKinney Center.
Yes.
And so the goal for Development Centers is to improve the lives of children and adults and to basically have them be healthy and happy. Okay. And so they focus a lot on the mental health. And so if someone seeks help for that, then Development Centers can help. And with the CCBHC program, we emphasize that, a lot and better. So we're out in the community doing events.
Wonderful.
And everything. We go to events. So like the World AIDS Day yesterday.
Yes.
That event went to. So yes, that's the main focus of it. Then we also do referrals for physical health if we know that someone needs physical health services as well.
Wonderful, wonderful. Okay, Dr. Young, in view of homebound, right? We're American Advantage Home Care, so we take care of a lot of patients who are homebound that are in need of vaccinations, of course, and do have some of those health and mental health related challenges and issues. Do you have any recommendations for the homebound community out there that need to be vaccinated at home and need to perhaps try to live, better lifestyles at home?
Yes, so we'll work with a primary care physician.
Yes.
So it's getting referrals for people to come help them.
Yes.
Like, and that goes for the occupational physical therapy, whatever it may be. And so there are different hospital systems or clinics that go to, mobile homes to get the vaccine. So,
Yes.
just for them to be open,
Yes.
and to keep them safe and everything. If they can't get out, then, find a resource to help them, someone to come in to help them. But it's important for them to do it.
Yes.
And so not to think, I'm just in a house, I'm not out there, I don't need to. So
Yeah.
that wasn't a thing like that. But
Absolutely.
yes, they should, still get the vaccines
Wonderful.
for the various things.
Let us in, right? Let us in.
Yes.
And our community partners, at
Yeah.
Wayne County Health Department and other venues that could actually distribute the vaccinations
Right.
at home. Last question for you, Dr. Young. All right, last question. With the wealth of experience that you have in this particular community organization and the work that you've done with the City of Detroit Health Department and Henry Ford Health Systems, are there any other resources, specialists and or clinics that you would recommend to Detroiters to live a healthier lifestyle as well as to get vaccinated during the National Influenza Vaccination Week?
I would suggest that they look at the different resources from the health department. So let it be Wayne County Health Department, Detroit Health Department, Oakland County Health Department. Different organizations. It's a lot of organizations that's out here
Yes.
to help. And
Absolutely.
people just have to, search for it. They don't know about them. They can look for things at the Mission Disease,
Yes.
Health Human Services, department.
Yes, Department of
and
Health and
to,
Human Services,
and so
yeah.
to understand what's going on, and they have some resources. So just seek the resources.
Yes.
When it comes to the information, to understand more about the vaccines and more
Awesome.
about the diseases, they should go to the Center for Disease Control website,
Yes.
so cdc.gov.
Yes, ma'am.
They should look at those things. If they want to know what's going around across the world, they can
Yes.
go to World Health Organization,
WHO.
Yeah.
Yes.
WHO.gov. So it's a lot of resources, a lot of things being published. But yeah, so they have the help is
Yes.
out there. So they just have to seek it and receive it.
Absolutely. Dr. Young, thank you for joining our show today.
Thank you.
Thank you for all the work that you do in the community to improve the lives of Detroiters.
Of course. Thank
And
you.
Happy holiday season to you and your family.
You too.
Thank you, Dr. Young.
Thank you.